This is Dr. Karen Bruder, here to share with you ideas on how to engage your doctors in Provide 2.0, which is a very common challenge. Let me help you to know your audience. Doctors learn the art and science of medicine. We value our autonomy so we can use our experience and education to practice the art of medicine. It can be a huge change to rely on best practices instead of on our own experience. Also understand that surgeons are fixers. We like immediate gratification and permanent fixes. We see a problem and we want to solve it right away. By our very nature, it's difficult to stay engaged and watch gradual improvement. We are very competitive, as you must be to get into medical school, get a good residency, pass your boards. We compete with it ourselves and with each other. We want to do the best we can for our patients. We give a lot for the privilege of practicing medicine. It takes years of our lives and sacrifices in your personal life to get training. We incur a lot of debt and we accept liability. We expect to have certain rewards such as autonomy, control over our professional life, respect, and personal fulfillment. Currently, we face business and regulatory pressures. We are doing more with less and have increasing liability. Throw in some QI initiatives and peers deciding what we can do, also known as best practices, and we can get pretty grumpy. Now, taking advantage of your newfound wisdom, how can you get your docs engaged? Involve them early in the planning. Make them part of the team. Let them think it was their idea. Put the patient in the center. It's really hard to argue when someone shows you data about better patient outcomes. Distribute individual and group data as transparently as you dare. No one wants to be an outlier, and we will compete to bring our rates down. Don't make phony changes. If we're going to engage, we expect to have support on the unit, not just new policies, and we don't care if the hospital is saving money. Most of all, value physicians' time. When nurses and administrators have quality meetings, they are on the hospital clock. Doctors, however, are either using their personal time or are losing income by seeing fewer patients. Everybody wants to feel appreciated, so let them know that you appreciate their time and their ideas. You can respect everyone's time by making their lives easier. Reduce turnover time, get them home sooner, have standard order sets, show them how standardized practice results in fewer nursing phone calls and fewer errors. Figure out a way to allow them to stay home while patients are laboring, to encourage them to be patient. Be generous with praise. When you have successes, share the credit with them publicly. Let the staff and patients know that they are engaged in promoting quality and better care. If a patient gives them a compliment, make sure you pass it on. And don't forget the innovativeness bell curve to remind you that convincing some docs will be easier than others. Bring in the innovators and early adopters because they can be your cheerleaders as you go forward. Keep up the positive messaging in casual conversation, such as in the doctor's lounge, nurse's station, or even in the elevators or cafeteria. Be HIPAA compliant, of course. Other docs will take a little more work or will make you miserable or try to sabotage the project with their negativity. Be prepared for them. Dig a little deeper and listen to their issues. Bring groups of docs together who have common challenges, such as those in private practice, those who hire CNMs, or the hospitalist group. They may have great ideas that you haven't thought of as you go forward. According to Max Planck, a new scientific truth does not triumph by convincing its opponents and making them see the light, but rather because its opponents eventually die. Rather than waiting for folks to retire or die, try these steps first. Be thoughtful. Know your doctors and their challenges. Know the data. Anticipate their questions and reactions. Always keep the patients in the center. Most of all, be patient and persistent. Communication is the key to success in change management. Good luck with all your efforts in reducing your cesarean section rate.